Okay, good morning, everyone, and thank you for joining us today. And I'm happy to announce the start of a series of ESME Journal Club. Today, we will mark a new step in a journey for intellectual exchange, learning, and discovery. I would like to pass a heartfelt welcome to our prestigious presenters, Dr. Asma Abdel and Dr. Emre Ozoran. We are privileged to have you today, and we are eagerly anticipating to hear your insights about gamification in medical education. Okay, before we proceed, I would like to go through some housekeeping rules. Please keep your devices muted during the presentation, and a Q&A session is scheduled after each presentation for questions and inquiry. And I would like to explain briefly the unique format of our journal club. So each journal club is divided into two sessions. The first session, like today, is expert-led, where they share insight about a specific topic. And the second session, which is scheduled 1 month from now, will be participant-led, and you will be encouraged to nominate and present articles for critical appraisal and discussion. I will let you know at the end of the session how can you nominate and how can you participate in session 2. But now let's start the session with my dear colleague, Dr. Asma Abdel. She is a professor, associate professor of medical education at Swiss Canal University, Egypt. She is director of the Health Profession Education Center at Ibn Sina University, Saudi Arabia. She is an ESME board member, associate fellow of EMI, and international FAMER fellow, and she is my dearest colleague. Dr. Asma, the floor is yours.
Thank you. Thank you so much, Dr. Angie. Hello, everyone. Thank you for this opportunity, and thanks for everyone for your attendance. As Dr. Angie explained, we are managing a new platform for Journal Club. I'm a member of the team who planning Journal Club with Dr. Angie and Prof. Abu Lata. This is a new concept from ESME to introduce Journal Club in a new way. So today, at the beginning, I want every one of you just to know each other. Go menti.com and scan this code, scan this QR code, or go to menti.com and use this code. And I need you to share with me to to know each other, but at the beginning of this journal club.
Dr. Asma, please reshare your screen.
Yeah. I share now the code.
Yeah, and present, please.
Yeah.
Thank you.
Here we received 2 responses from you. We have general surgery from Turkey, dentistry from UAE, Emirat. Okay. So we have 2 different professions. You can scan this code and respond with us in this code. Egypt, Mansoura University, medical education also. We have 2 medical education. Egypt also. Nursing, Saudi Arabia. Medical education, Unit College of University, Juf University, KSA. Nursing education, India. Medical education from Egypt. Chemistry from Saudi Arabia. So we have different professions and different areas and from different places. Okay. We have medical education from Libya. So we have different countries until now, European countries and India and Turkey. So second question, I need you to reply on it. Please scan the code, QR code. And are you familiar with using gamification in medical education before? Any one of you, يعني not necessary in medical education because we have many specialties and many professions. We need to know how many are familiar with using gamification in medical education or in his course or his career. We have in chat also Dr. Daya from Mansoura University and Delta University. Okay. Forensic and medical education, Dr. Daya, both. Okay, until now we have responses from 9 persons. We have 5 with no. Okay, I'm waiting more. Scan this QR code and response, yes or no. We have equal yes and no now. As most of the attendees from education background, so that it will be enrich our discussion today in Journal Club. We have 7 no and 6 yes. Okay. I will stop share and stop responses, and we can go with our Journal Club. Thanks for your participation in this very short survey, but I need to know the audience who attending this Journal Club. Our Journal Club today will containing in our agenda, we have 2 sessions. First session led by me and second session with my colleague, Dr. Emery. I will present for you today regarding what is gamification in a simple and gamification in medical education, and what is the difference between serious game, gamification, game-based learning, series of gamifications in light and benefits of using gamification, pros versus cons of gamification, game-based learning, and serious game, 12 tips for incorporating gamification in your medical education, and gamification example in education. What is gamification? Any one of you are familiar with the definition and what is meant by gamification? Can use chat function if you need. Okay. Gamification means that we are using the game's attributes or features in non-gaming context. And also there is it is a method in which we can use more than game elements in a process for better transferring of our knowledge and simplifying of our knowledge. Set of activities and the process to solve different kinds of problems inside by applying games into context of your content. And by applying these game elements, your users and students will be more active and they have fun in education. And these game elements, game-like elements, encourage more participation of your students and enhance their engagement, immersion, and increase more team working and collaboration. The idea of using games is introduced in medical education in the clinical setting with Forrest proposed in 2002. In gamification, we have some kind of behavior change from your students, and we need compliance of your participants, and it is increasing, as I mentioned, their engagement and helps them to do problem solving, plus they have some kind of fun. We should consider some elements like game elements and what kind of rewards we will use with our students and how this gamification do motivation through which processes and what kind of users we get. Gamification in medical education is considered as learning outside the box. Gamification was present before COVID-19, but it is increased and used more during this pandemic due to, as all of you know, sudden lockdown and sudden transfer of education from face-to-face into virtual one. And so in that time, not suitable to use the traditional way of teaching. We need to innovate many methods, increase the students and participants' engagement in our teaching. So there is a need to use gamification in medical education or during our online learning to provide high quality and engaging medical education during this virtual setting. When using technology, when we have more improvement and enhancement of our technology, there is more improvement in using gamification. And the use of AI will help us to introduce more interactive and more advanced methods of gamification. When using technology enhanced gamification, as there is some gamification can be used very simple methods like paper games can be used inside the face-to-face classes, or technology enhanced gamification. And in this case, we improve our student engagement, digital literacy, improving problem solving, improving cooperative and team working, and also they are gaining many important skills for which needed for them as they are 21st century learners. They need to gain more information about technology and how to use AI properties and features in the future. Also, a gamification encourage students to share in learning by promote their competition among their peers and improving their collaboration work. And I will explain more how to use it in collaboration and versus competition situation. The use of gamification in a repetitive way or kind of repetition of information in different ways, plus using gamification, is a key to reinforcing learning and reinforcing information in effective methods to make this information more deeper inside inside the brain of your students. What is the difference between gamification? Now we are explaining gamification in its simple way. We have serious game and gamification and game-based learning. I need to clarify for everyone with you now, what is the difference between the three concepts? If anyone have any idea, you can share in chat. What is the difference? Do you think, what is the difference between the three concepts? We explained before the gamification in its simple definition. And what is the difference if we say game-based learning, and what is the difference if we say serious game? Sorry, Dr. Inji, but I can see chat. Now it is working. Yeah. Serious game can be used for gamification from Prof. Mona. Thank you for simulation. Any responses? طب if I present for you this figure, what you can understand from this figure? If we check this pyramid, what it is reflect for us? Okay, Dr. Sadia, gamification involved incorporating game-like elements, okay, such as points, badges, into game context. Perfect. Enhance engagement and the motivation. It is a strategy to make activities more enjoyable and tapping into psychological aspects of game. On the other hand, game-based learning involving using actual game designing for educational purpose and teaches specific concepts. Dr. Sadia provided a very constructive answers. Thank you, Dr. Sadia. Dr. Mona added the gamification is used to better engage students in classroom. Okay, Dr. Islam added that enhanced deep learning. Thank you. Dr. Nancy said that it is a tool of teaching and game-based learning is a strategy. You can see game-based learning is introduced game designed for educational purpose for different learning activities. Okay, Prof. Mona. And Dr. Mustafa Abdulnas, Prof. Mustafa, one of the tools of AI. Okay, all your participation is excellent and more than excellent. Gamification, يعني to simplify the three concepts or three concepts, I put them in this pyramid and explain that if we are going from gamification up to serious game, we go from simple to complex. This is in simple way, as explained by all of you in chat. If we revise again what we are saying in the chat, all three concepts are effective to motivate our players or our learners. Gamification, in its simple word, is applying game elements into non-gaming context. Yani during teaching, we can use, as said by Dr. Sadia, we can use badges, points, stars, leaderboards, any kind of games elements inside our teaching and during our teaching, okay? But game-based learning, during game-based learning, it is a way to introduce certain learning or certain objective or learning objective or certain content in the form of game. So especially developed game and is the way for learning. So it considered as a method of learning or يعني we can reach it into strategy, but it is a way of learning, Dr. And there is example for this, like Minecraft Education Edition, where a student can explore and create within the Minecraft world while learning subjects like history or mathematics. I check this game kind, and we can learn student history through this game. Okay, and I put here the link for this game. Serious game, as mentioned by Prof. Mona Absoud, is that it is better to be used for simulation. يعني the definition of serious game is a game from its beginning is split and started and especially designed for certain, its primary goal to transfer knowledge or teach certain skills in a simulated environment. So it is better to be attractive virtual world. We can use it as a simulation hospital. We can do simulation in ER environment, and we train our students or our residents or maybe our clinical year students in this simulated environment, so it considered as a safe environment, and we can ask our student to practice medicine and deal with cases in a simulated environment, so we avoid any harm effect will be affect our students if it is inside a real environment. And so it considered kind of training or learning. And we have, during this environment or this game, serious game, we can give our students kind of encouragement and kind of progress or follow up of their progression until they achieving more and higher levels on earning more points and progress. So a serious game, in that case, is more complex and need more preparation. So here in this comparison, what is used, why we use each one of them In case we use gamification in its simple word, as we said together that it is game elements and non-gaming context, it increase our students' engagement and increasing their extrinsic factor for motivation inside the training or learning. And also we how it is used, we can add extra layer of game, extra layer of activities inside our already learning environment. But in game-based learning, we can say that it is used for increasing engagement and help us to transfer information and transfer of learning and transfer of knowledge. Make يعني lead give our students the opportunity to learn new skills and abstract knowledge. Plus it is used in use of existing games, ready-made games within one and these games are directed to certain learning objective of our session. But in serious game, as I mentioned before, it is already we designed, this is a built on game from the beginning, and it's aimed to certain training or certain teaching, plus increasing engagement and the motivation and transferring the knowledge and the abstracting of knowledge. It trains students in new skills like problem solving, clinical reasoning skills, ability to manage cases in different situations, in ER situation, and creates their awareness about this simulated environment we use, and it changes their behaviors. So games are created from scratch, aiming to this training or aiming to this course. I think Dr. Emery will give you more about this part. I have this application. I found it inside the App Store. This application is a good example for serious game, and it is explaining how we can do realistic medical simulation inside the ER, and there is many cases with narrative scenarios about the situations and these cases in ER, and the candidate are entering inside this game and started to solve the cases one by one and see their progression. And when they catching a certain level of cases, they reaching for level up to another level. And some postgraduate residency program using this app as evidence for their continuous medical education and continuous progression and training. Right. In this point, I will move with you to what are the theories underpinning the gamification. There is self-determination theory, and it is a common theory which is common in motivation. First one, because self-determination theory underlying both that in case of successful or non-successful gamification, it results in behavior change of our candidate. In self-determination theory, the factor which is working more is intrinsic factor of motivation more than the extrinsic one, okay? There is three key gamification principles outlined in this area. Inside game, the student have goal setting and learner control and engagement. Three factors are working together to achieve his game. Tools which is a gamification system can fulfill the psychological needs of self-determination theory. This is the first theory we need to know about to help in gamification. Second one, we have the expressional learning theory. Expressional learning theory, all of you are knowing that we are learning better when we're facing more experience, we learn more and we have more deep learning. In expressional learning theory, the candidate are immersed in a certain experience, and after this, he will do his own concept and do a reflection about this experience he have, and also they think in ways to improve themselves. And after this abstract conceptualization, they will try to improve their behaviors and performance. Some researchers found that gamification is important and are reflecting the expressional learning theories because of use of reflection and conceptualization to enhance learning inside the learner is his brain. Self-directed learning, all of us are knowing that we need kind of students who are self-directed, who can assess their needs for learning, who can know and formulating their learning goals and to planning how to do their learning achievement using certain learning pathway or certain learning milestones. There is increased autonomy of our candidate on their learning, and independent learners, we are needing them. So gamification inspired self-directed learning and involve students into this process to be active learner, and they can determine when do they share in this game and when they are needing more information to know about this part of curriculum, and to assess their learning needs and learning readiness, and when they can cover this knowledge gap they have. So it is an effective to use self-directed learning concept. From another theories, we have also deliberate practice theory. It is a deliberate practice theory based on engaging already motivated students to become experts, very well-defined goals and real-world tasks, and the immediate informative feedbacks were received during this game. It is applied to develop an educational tools using game elements and virtual reality to practice, like, for example, in nursing education, they're using this for applying the student skills in doing urinary catheterization in simulated environment. Reinforcement learning theory, all of us are knowing the reinforcement effect or reinforcement learning theory and how we can benefit from mistakes, and we have how our learners can benefit from their correct or even wrong answers. It is related to a kind of behavior theories and depend on rewards and punishment in desired behavior on action, and following rewards, the tendency to perform action will increase. When the candidate do the correct answer, their performance increase and they need to do more games to gain more and earn more points or rewards. And in case of punishment, yeah, not kind of punishment, but in case of mistake or doing something incorrectly, they will learn from their mistakes. And at that moment, we should give our student another attempt, not using only one attempt, because it is not a real exam. It is kind of a formative or kind of learning tools during gamification. So we can encourage our students to practice more and more to increase their performance and benefit more from their mistakes. So gamification based on this reinforcement learning theory, as the students will receive points in case of rewarding, and maybe in case of punishments, they will lose some words, and in that case, they will be more motivated to learn and to improve their performance. So if I with you, this is the benefits of using gamification in e-learning. As I mentioned, we use gamification before COVID-19 and increase its use during COVID-19 due to many factors, as I mentioned, to make learning more interactive and make it enjoyable. So it is make learning enjoyable, bring fun to our students, increase their motivation, increase team working, collaboration, and increase their experience and playing in their expressional learning, and put them in a faster and better learning situation. Here I will present for you what is the pros and cons of using every one of gamification and game-based learning and serious game. Gamification, as I mentioned, it is a simple implementation and low development cost and can be applied in extra layer of existing product or intervention or content, and great for making repetition for or pouring action more fun. Yani if you have pouring information or pouring subject or pouring content, if you do some kind of repetition through games, it will help your student to regain or retain this kind of information. But what are so it effective in stimulate competition between your candidate. طب what are the cons of using gamification? Less effective in long run courses because the students will pour from sharing in same game in a repetitive way. Only appeals to be a limited group of students, and mainly people who are performance oriented were not interested in using gamification. Can't be used for all types of problems, and with only gamification you don't learn new skills. It's just only a games, as I mentioned, inside in between your course. In game-based learning, what is the purpose of using game-based learning? Appeals to for many target group or many kind of students will show interest of using game-based learning and provide a learning environment in which users can experiment and receive immediate feedback from their actions and their performance. So this environment allows students to gain new information and new kind of knowledge, and that can be transferred in different levels. Due to high immersion of your student inside the learning environment, it keeps them attention for a long time. But there is kind of cons if we use it. The use of game-based learning depends on supply. There is not a game for every possible content or every possible problem we have in our curriculum. A companion or instructor or teacher needed to probably guide game-based learning. Yani it should be well designed and it should be in alignment with your learning objectives and with your course content and for the context or in the learning environment, and have all the available technology or if you depend on internet, smart device, and everything should be available for your candidate. So facilitator should have extensive knowledge about this game he designed for his course. In serious game, as I mentioned, it is built in games from the beginning, especially designed one for a certain training or certain course. In serious game, the benefit of using it is widely applicable for almost any type of problem or objective because it can be fully customized, can be tolerated by any possible target group of students, and wide range of available games we have. It is effective for a long time because the players inside this serious game are intrinsically motivated to continuous playing and gaining more progress inside the game. And we have behavioral changes and immersion of our students inside this kind of change, this kind of training or this kind of games makes their brain think in different ways, and their brain neurons change it and behavior of their thinking, and also they gain more information and increasing their deep learning. Has high degree of immersion inside the learning environment and inside the intervention you are asking them to do inside these serious games. Cons of using serious games is that the development of serious game is complex and take a long of time and therefore often more expensive. It requires specific domain knowledge to be developed and needs more development of serious games. Until now, I finished this difference and pros and cons, and I will explain the 12 tips for gamification into medical education, but I need to take from any one of you if there are any inquiries until now, or everything is clear. I can continue with these 12 practical tips for incorporating any gamification concept in your course. In 5 minutes only, I will explain these 12 practical tips. First one, we should identify as any kind of teaching or any kind of assessment, we should have our learning objectives and align our gamification with these learning objectives. Yani to be relevant to our courses. Choose one or two gamification, no more than that, to avoid overwhelming our students with the games inside the session, and this is makes them more distracted. Ensure that gamification or elements are reusable. Yani we can use it more and more to avoid that because developing games, it takes time from the instructors and you need more effort and time from you to prepare games for each lesson. So you should use a reusable one. Incorporate social learning and collaboration inside your gamification strategies. As I mentioned before, we can do some kind of games which is depend in individual response. In that case, we do individual competition or peers competition, but better to use team and collaboration among your students, and divide them into games into teams and groups to encourage more collaboration and team working. Use feedback and rewards to motivate your learner. When the learner gain a certain level, they can receive a feedback from you, or kind of rewards that reinforces their learning. And consider use of badges or leaderboards to promote competition among them. Use storytelling and narrative structure to immerse your students inside the learning environment. As I said before, in the simulation-based games, we use scenarios for cases about a certain case and how to solve this case, to use their learning clinical reasoning skills and problem-solving critical thinking. Utilize of technology to allow you develop more kind of games. Ensure that gamification elements are relevant to your course. Avoid many games, as I mentioned, to avoid any distraction. Consider the ethical implication of using gamification and evaluate its effectiveness in your course. This is 10 ways to make your learning as a game. I will leave this it is a repetition from how to incorporate games inside your course. And also this is how to make your learning like a game. These 10 ways you can use for your future practice. This is different example we can use for using games in your education. And this educational technology website containing more and more. And I will let the floor for Dr. Emre to explain more in this point. By the end of my session, I wanted to give you this take-home message. Make learning fun and expressional can improve your learning motivation. Feedback and repetition can make their learning more effective. Gamification is about collaboration more than that competition. Ensure that gamification elements are reusable and using technology to facilitate this task, and consider implementing 1 or 2 gamification, no more than that, to avoid destruction of your candidate. And this is the 2 articles we use in this presentation, and I'm ready for any questions. Thank you. Now we will check another experience from Dr. Emre. Thank you for your listening.
Thank you, Dr. Esma, for this concise and informative presentation. We'll have some time for question and answers. If anyone wants to share experience or ask a question, please unmute yourself or type in the chat. Okay, Dr. Asma, they were thanking you for the informative presentation, and it's clear and to the point. Any question or any experience? Does anyone use gamification in his or her teaching session and find a good or bad results?
I think Prof. Wagdi joining the session.
Yeah, we are privileged to have Professor Wagdi, the ESME president. Professor Wagdi, can I invite you for a few words? We have one question. Okay, Dr. Amira Samia have experience using gamification tool, Kahoot platform.
That's
Okay. Dr. Mona, please unmute yourself.
Yes. Good afternoon, everybody. I'm very privileged to be among you, and I enjoyed your presentation very much, dear Dr. Asma. I have actually experience with using simulation-based interprofessional education. I was working at an institution some years back, and we had this interprofessional education-based module. It was held in the spring of every year, and the students came from different medical professions, Faculty of Medicine, Dentistry, Pharmacy, and the Health Sciences, with the different subspecialties. And they were subdivided into interprofessional teams. First of all, we used case-based learning, paper scenario, scenario of a patient that had to be solved in classroom in interprofessional teams. And then they were further subdivided into interprofessional teams having to go for to solve different scenarios, either emergency or a chronic case in the skill lab. So it was really very interesting for the students, for all of the students, and it was very engaging, and they were really immersed. I like using this word. They were immersed in the different cases, and then by the end of the course, they were shown the ideal management plan of each case, and samples of video recordings from the different teams were presented to them. One of them showing the best performance according to their the different checklists used, and another one worst performance, so that they can learn how they performed and versus what the ideal management plan would be. Thank you very much.
Thank you, Prof. Mona. Very good experience. Yeah, you provided us. Thank you. Dr. Amira. Dr. Amira, Alaikum salam.
Hello, everyone. Thanks, Dr. Asma, for this interesting session and the presentation. And I have experience in using a gamification tool in my sessions, the Kahoot platform. It has a very a good impact on my students to engage the student in interactive session. Through it, I can assess student knowledge in very creative way, as you said before. Really, Kahoot platform can create enjoyable environment and competitive. And I feel this with my students in the session. The sound effect and the point collection mode of this platform really create this enjoyable environment and very entertaining, really. Through it, I can use different formats of questions or quiz types as single best answer or essay question. I can also use the case-based scenario, and I can, through this platform, store my quizzes and my questions. Really, it was an interesting and very beneficial experience for me and for my students.
So it's a very good experience. I need to inquire about two things. Okay,
Yes,
Dr.
for learning and for formative assessment, for interactive sessions and engage my student in the session. Also, if we need to make an ice breaking and introduce a new content or new topic in the first in the beginning of the session, I can use it also. Another tool I used it, ClassPoint application that I can download in PowerPoint presentation. Also have the same benefits and the same character of Kahoot, using different types of test items, engage the student in my session. Also using introduce new topic for ice breaking and so on, and create a really enjoyable environment. Thanks, Dr. Asma.
Yes, I need to know from you what is your specialty and how many students you practice these activities with them. How many students in your class?
Okay, I'm Dr. Amira Sameh, Assistant Professor of Human Anatomy and Embryology, Faculty of Medicine, Zagreb University.
Interesting anatomy.
Yes.
Interesting. Okay.
Okay, Dr. Asma. Kahoot, يعني cones of the Kahoot really depend on the groups due to limited number of players. Free version, okay? So I can't assess students individually. and I implemented this a game with 40 or 20 students. Okay, students. And I divide the students into groups, and each group act as one individual. Okay, this is the disadvantages of this platform in the free version. Okay, plus this game need the network, good network. Okay, so there is a limitation in using it frequently. Also, the limited number of letters that can I tap it in the questions, especially case-based test items. There is limited number. Okay, so this is the disadvantages of this platform. But I think the advantage is more and exceed its disadvantage. Okay, Dr.
Thank
Asma.
you, Amira. Thank you. Thank you for this interesting participation, Dr. Sadia. And this is the last sharing, because we need to start our second part of our journal club.
Assalamu alaikum, Dr. Asma. I'm Dr. Sadia Yasin from Medical Education Department, Pakistan. First of all, I extend my sincere thanks for such an enlightening session. I would like to suggest that while integrating gamification into our curriculum, we must consider the Bloom's taxonomy level.
Yeah.
Do
Again,
you agree?
do you agree? Please, Dr. Sadia, repeat your question again.
I have no question. I just suggest that while
Dr. Sadia, this is Wagdi Talat. Could you explore more on how to link gamification with the taxonomy of educational objectives? Could you give us an example of that?
So, for example, if we want just our student, we are taking some basic class of some subject, for example, anatomy. We are just trying our student to remember some things. So, for that purpose, we will just utilize quizzes and flashcards. And for some complicated or some more complex cognitive level, we will formulate the games or integrate the gamification according to the level of Bloom's taxonomy we want our student to learn.
Yeah, Dr. Sadia, you refer again.
If you allow me, Dr. Asma, but do you think, Dr. Sadia, we can reach the top level of the cognitive domain of the taxonomy of educational objectives and use creation with gamification? Can we reach that level?
Sir, say there are certain limitation. This was suggestion that to some extent, till what extent we can do integrate the gamification according to the level of Bloom's taxonomy. We should consider that in this case. I'm not talking that we can reach the top level of Bloom's taxonomy while integrating the Bloom's taxonomy. Definitely, we can't create by gamification.
Thank you. Then we can consider that, Dr. Asma, in our curriculum design. We can, use gamification with the different levels of the taxonomy of educational objectives and just use it for the proper level that we assign our curriculum to. Thank you.
Sir, I do agree with you, sir.
Thank you, Dr. Sadia.
Thank you, sir.
Thank you. Thank you, Prof. Thank you, Dr. Sadia. But I need to explain more in this area that I mentioned in the presentation. In every game should be linked for your learning objectives of your session. And every session has different learning objectives distributed among Bloom's taxonomy. So according to which learning objective you need to achieve, it is at the recall level or interpretation or application. So according to that, you plan your games. Okay, thank you for your participation, Dr. Sadia, and thank you, Prof. Floor for you, Dr. Engi now.
Thank you, Dr. Asma. Thank you for your contribution. But we had a hand from someone called iPhone. I don't want her to be shut down because you said Dr. Sadia is the last contribution. If she or he wanted to ask a final question, the floor is yours. But I don't know the name. It's just iPhone. Okay, feel free to raise your hand at any time, and we're happy to have your question. Professor Wagdi, we met you at the start of the journal club, and we have a few minutes. If you would like to share a few words with us, we'll be privileged to have you.
Thank you, Dr. Angie. I'm sorry I was very busy in some problems in our new journal, Journal of Health Professions, Education and Innovation. And I will take this opportunity to invite all of you to submit your manuscripts to our new journal. Actually, we have international figures and experts in medical education on board of our new journal. Dr. Angie will send you the link of this journal, I started listening to this excellent journal club just 15 minutes after it started, and I think we are going well. I would like to welcome Dr. Emery from the Famer Institute. Hello, Dr. Emery.
Hello, sir. It's a privilege to be here.
It's our pleasure, and the floor is now back to Dr. Angie.
Thank you so much, Professor Wagdi. And now we are going to start the second part of our session with Dr. Emre Ozoran. He's a surgery specialist and the coordinator of the surgery residency. He has a passion and a special interest in gamification in medical education. And of different examples about use of gamification in teaching sessions. Dr. Emre, the floor is yours.
Thank you, everyone. It's a privilege to be here. I think my slides are seen. Yeah. So last year we were together with Dr. Esme, and we had a group in our Famer Institute. We were doing gamification in health professions education, and we performed in a very good team way. And I would like to acknowledge all my friends in the group and our supervisor with the knowledge I obtained in gamification. So I know Dr. Esme already did it, but I'm going to ask everyone, let's change the subject a bit before starting with some examples. You can scan the QR code, or you can go to menti.com and enter this code. I would like you to please describe yourself with a single word. So if the QR code is not, yeah, inspiring others, very well. So the QR code is not here, but the code for menti.com is, yeah, you can also draw some. Menti is a very good tool. Then you have internet, of course. As you know, people are not people do not have to have their laptops. You can reach it via the smartphones very easily. Even the cheapest smartphone can reach it. So I think it's a very good way to engage students and have a feeling who your audience is, like Dr. Esme did at the start of our session. After you finish this, there is a second question, but I would like you to hold until then, until our next question. Yeah. So some people describe themselves with their professions. Some use their other characteristics, but it's a nice way to learn about your audience. So I'm just going to continue. So let's continue with our next question. Dr. Rasmus asked a similar question. It's in the same code. It's the next question you have. How many of you are familiar with Kahoot or Educa Play? I'm just going to switch to that screen. Sorry. So people have used Kahoot. We have 7 answers. One person have used both. So I think this is also a good example of seeing the attendance in this class. We are having this time the Journal Club about gamification. We have at the moment, I think 45 participants, and we are motivated for this Journal Club, but as you can see, we have only 8 answers. So even if you're doing engagement like this in an audience which is educated, which is at your similar level, some people don't participate. So even it's, as you can see, it's hard to get everyone to participate. So let me just turn back to my presentation. So for Kahoot, Kahoot, is the screen visible, by the way?
Yes, it is. Yes, we can see it.
So Kahoot is a very good way. It's quite easy, but as you can see, I put some dollar marks on the screen. It's not free. I mean, you have the free version, which we are going to play a game with you all together, but it's not free. So you can go to Kahoot. This is a screenshot of the website. You can go to Kahoot. You can start a question, insert some media, and you can use your smartphone as a remote control. Previously in the congresses, there were some Q&A sessions, and you ask the audience about their opinions, and they used to give you a remote control like this, and then you push some buttons. You have to spend some money on this. But with the advancement of technology, everyone has a smartphone. So with this Kahoot, everyone can use their smartphone as a remote control. So let's go to this game. Now you can scan the QR code here, or go to kahoot.it and then put this game pin. So I'm just going to wait several seconds more, and then I'm going to go to the control screen. And let me also get it. You can put a screen name, whatever you want. Let's go there. Just a second. Let me open it. So let me start it. Yes, I'm sorry, this will be your new QR code. Yes. Yeah. Or you can use the game pin. We have one player, we have two players. The free version only allows you to have 10 players. So we're going to start now. It will ask the questions and then you will use your phone or your computer to choose for the answer. So the first question is, what is this person doing? You can put a time limit. I put 60 seconds for this one, but it finishes when everyone answers or when the time ends. So 6 people knew and 5 people choose the wrong answer. And you can see the picture. This person is experiencing a VR scenario inside an ambulance of a patient with pneumothorax. So let's go to the next question. This question was a multiple choice question. It's available for everyone in the free version. Now it will be a true and false question. Oh, we have the leaderboard. So Fofo is the leader at the moment. Now it's a true or false question. The timing is also important. So 9 people were right and 1 people were wrong. Let's see the leaderboard now. So Fofo is still the first person and the second and third are changed now. Let's go to the last question. Where are these people? This is a photograph. You want you to choose.
Can you hear me?
Yes.
From the mobile phone, the questions are not displayed. So I think if you change the setting to show the question and answer, it will be only the answers without the question.
Yes.
Only the colors.
Yes.
So you have a setting icon down there in your screen beside the mic. If you can change the setting to show question and answer, this will allow us to see the questions and the answers on our mobile phones. Yeah, this one. Yeah.
Okay.
The setting icon down there. Yeah. Yeah. Okay. Exactly. Yeah.
Okay.
Thank you.
You're welcome. So now we are going to choose the winner. The third one is May. The second one is SM, and the first one is Foha. So this is a way to engage players, engage students in a way. So this was the competition we had. So as you see, I am the first one. If you are doing it yourself, by yourself alone, you can also get motivated. You can change the score you have.
And you choose Ronaldo or Mo Salah?
Yeah, well,
By the way.
well, I'm from Mo Salah. I really like him from his earlier days as well. Yeah.
Excellent.
But there's a competition. The next site I'm going to talk about is EducaPlay. It has also some free parts. It has very good integration with Google Alphabet and Google Board. There are several games that you can design for your students. You have crossword puzzles. You can create quizzes. You can create fill in the blanks. You can create Froggy Jumps game and other riddles as well. So this time I'm going to put this in chat for you to try. Everyone can try on their own. And I'm going to open it for me so you can see. So this is a Froggy Jumps game. You can write your name, write anything. You can do a temporary name or nothing. Let's start. I mean, this is a simple game, Froggy Jumps. I ask a question. If I put in the right answer, the frog jumps. For example, let me choose this one. Oh, I'm safe. I'm trying to cross the river. How is gamification used? Oh, I chose the wrong one. And I drowned. So I could pass. This is another way to engage students. And in some cases, the lectures you give, the interactive discussions you do are on subjects that are not very pleasant for everyone. The theory load is high. So you can use games like this. You can do gamification like this to make things more interesting. It's very easy to create this. It has a very straightforward interface. Once you go through it, you can log in through your Google account. Once you go through it, you can do it very easily. And with the free version, you can do this, create this, and use it with unlimited number of students. Unlike Kahoot, for Kahoot, I mean, in the last game with it, you can only do with 10 students in the free version. Dr. Esma talked about the theory in a very, very good way. I'm going to talk about serious games in a little more detail. On the screen, you can see several snapshots of photo. So serious games can be both educational and enjoyable because they are intrinsically motivating. The game environment is responsive and can have a complexity that allows for learning opportunities. There's a game created for kids with ADHD. It's called Endeavor RX. It's a very good game. It's prescribed by pediatricians in US, and the Social Security pays for this game. So it helps students become more focused. It was shown clinically. On top, you have the game called the Flight Simulator. If everyone is interested about flying planes, it is a game which is, creating a simulator is very expensive, but you can play this simulator in your computer, and you can fly planes like you do in real life. There's a game, it was prepared by the Financial Times newspaper. It's called the Uber game. Uber got popular all around the world, and everyone, especially in US or in countries like developing countries like us, when people try to immigrate to United States, some people first start with driving like a Uber cab driver, but it's very hard to earn money. You can go to this game and you lease a car, you drive people around, but the motivation for the Financial Times newspaper to produce this game is to show to everyone how it's not very easy to become a Uber driver. So they convinced and prove a point to people about the inside of the Uber driver. So on top, you have a game which is created by the US Army, by the way. It's a game where you become a US Army soldier, and you do attacks on people who threaten US. And this game is also used to recruit more people to the US Army. So it's a very realistic game. It's like the other first-person shooter games, but this game was created by the US Army to promote US Army and to attract young people to join the army. So you can use games, and especially serious games, because it's very realistic, to make your propaganda, to teach stuff. So it's very usable. So what is the use in health professions? We are going to see a little, but I'm going to talk about a concept about fidelity. So fidelity is very important. What is fidelity? If you have any idea, please write in chat. What is fidelity? Here, we are talking about fidelity in the setting of simulation. Yes. So Soha and Mona Abdul are very right. It's precision of simulation, degree of reality of simulation, how authentic is this simulation. They are all correct. So let's go through it. Fidelity in simulation is a multi-dimensional concept corresponding to the degree of realism created through the selection of simulation, equipment, setting, and scenario. Fidelity also refers to the degree of exactness achieved and corresponds to the believability of the experience and relates to several components of simulation activity. So this is our famous Miller's pyramid, as you see. So the increasing levels of simulation fidelity goes to up the pyramid. So we have low fidelity simulators, medium fidelity simulators, and high fidelity simulators. Low fidelity simulators are anatomical representations of a part of the body to train simple tasks and to acquire basic motor skills to be able to develop those tasks. It is generally composed of low technology. Medium fidelity, they integrate low complexity software programs that allow manipulating physiological variables to assess knowledge during decision-making in environments such as CPR. High-fidelity simulators are life-size mannequins that integrate mechanical devices and computer technology to train advanced techniques and skills in handling critical situations. So this is an example of a low-fidelity simulator. We teach our students with this leg and arms model for suturing. We also have an IV catheter model. It's very simple, like a mannequin, very simple, low cost. And here you have a model we bought from China, where we can do upper GI endoscopy. It's very simple. In high fidelity, you have more options. So look at how realistic this mannequin is. You can have ventilation. It has a realistic look. Look at the teeth. It has pupillary response that can be changed. It has wide range of possible scenarios. The student provides some action, and then with the action, if the action is right, you can control it and then give the patient response to that action. So this is the ADAM-X model, and you see the characteristics. You have you have the iPhone, you have iPhone Pro, you have iPhone Plus Pro, you have iPhone Plus Pro Extreme. It goes like this. So with every option, every new addition of an option, you pay more money. Are we rich? Are we that rich? We are going to talk about it. So for trauma training, for example, it's also one of my areas that I'm concerned with, that I teach in the 4th year. So with trauma training, you have technical skills and non-technical skills. Technical skills like application of a correct triage, primary and secondary surveys, including techniques and treatments during these steps. You can provide this with different examples. You can have OSCEs with simulated patients. You can check the kids with multiple choice questions. And for non-technical skills, you can do OSCEs or mini clinical evaluations on real patients or simulated patients. But there are a lot of different tasks. And how are you going to monitor them on real patients? And when are you going to monitor them on real patients? So, especially in developed countries, human life is more expensive than the human life, the value of human life in developing countries. So in the Netherlands, they produced a game, a serious game, simulating a virtual emergency department. These are screenshots from the game. You are a doctor, you can go from room to room. You can go from room to room, you can attend patients, you can do CPR here, you can come back here, do triage here, you can go to the laboratory, you can look at the x-rays, you can have a fluoroscopy of the patient, you can talk with the patient's relatives, and you can encompass a lot of things. But producing this game cost them 500,000 euros. It's a huge money when you're a developing country. But once you develop it, you can sell it to other people. You can start earning money, but you have to do a cost value analysis if it is feasible for you. This was a previous one, a previous theme. It's called ABCDE theme. As you see in this game, you have some scenarios as well. You have some CPR scenarios, you can have trauma scenarios. You can do simple things. As you see, there are some options for interosseous wave, for example, IV catheters, for intubation and stuff. You can perform on patients. However, where are we now? The technology is advanced, more advanced, and in this I'm going to show a video. I'm going to pause at some points. This is a video. As you see, there are two people wearing VR, virtual reality headsets, and they can communicate with each other via, there's a microphone here also. and they can communicate with the characters which is in the serious game. So here,
man down. Yeah, I see the Humvee on fire over there too, but I don't hear any gunfire.
so I'm just going to tell you a little by little. So he says there's a man down, as you see, the soldier, the African American soldier is down. There is another soldier up here. The Humvee, they are talking about the SUV, the car is near. There was an explosion, as you can see. So they are going to figure out what happened to this person. So they just arrive at the scene.
Or anything. Man down. Yeah, I see the Humvee on fire over there too, but I don't hear any gunfire or anything.
I'm sorry. I'm just sorry. This video here, let's take you here. So here in the dialogue section, as you see here on the right, you have some options that you can talk with the guy. Yes, I'm Alex. You can introduce yourself. So they look at this patient, they ask what happened.
And there was an explosion that flipped the Humvee. I cleared the area and
they were in patrol and there was an explosion. This soldier cleared the area, but this man has a problem. The man down has a.
We were out on patrol and there was an explosion that flipped the Humvee. I cleared the area and I think we're safe. Must have been an old IED. You hurt? I'm all right, but Washington hit the ground pretty hard. Okay. Hey, soldier, what's your name? I'm Alex Washington. Okay. Well, patient's phonating, airway impairs clear. Hey, Alex, we're going to do a quick exam and try to get you feeling better, okay? Okay. Okay. Let me get him disrobed.
So he has Bluetooth controllers on his hand and they have force feedback. So if it touches, when he puts on the stethoscope and when you puts the his hand to the designated places on the body like this, he can hear the sounds of that part. When he moves, for example, look, he is putting the stethoscope on the right, he can listen to the right song, and he puts it to the left, he can listen to the left lung.
Okay, I've got bilateral breath sounds.
Now he's listening to cardiac sounds.
The right does seem weaker than the left.
So he palpates the left arm, and what you get is, because there is the controller in your hand, you can feel the palpation of his heart.
I've got good pupils radial pulses as well. Hey, Alex, so what happened? I'm not sure, but I landed on my chest. Where does it hurt? It hurts in my right chest. That's pretty operating. Okay, I'm going to take another listen real quick.
So he listens again. This is his view. The guy on the pink, with the pink scrubs.
Yeah, he's definitely decreased on the right. I think he's got a pneumo. Really like it. Why don't you go ahead and check his pulses again? Okay. He's pretty tacky, probably like 130s. I pay attention. Yeah, I think you should go ahead with the needle decompression. Do you have a 14 gauge? Yeah. Here. Let me take another listen.
So they put the needle there.
Yeah, I've got good bilateral breath sounds now. Wow, that feels so much better. Okay. How far out is EMET? I called for transport, but it's going to be another 20 minutes. Okay, I think we should start getting him prepped for transport. Okay, let me check his pulse again. Still 2 pulses bilaterally. A little slower though, now like 100. I think I'm gonna drop a sternal IO and we can start running a liter of saline. Okay.
They put an intraosseous line on his sternum and started IV hydration. And you know so the guy in the pink figured out that there are no breath sounds, and then he gave the needle to the blue guy. So he did the decompression of the lung. They solved a medical case. They worked together as a team. They had a communication. And they did this with only the software and the goggles. They didn't need any fancy, expensive mannequins to overcome this scenario. So I would like to learn what are your reflections on the VR video. You can put in chat as well if it's easier for you. So the code for this, if you are going through Menti, is 74, 21, 84, and 62. So it is applicable for large group of students. So I mean, you only need a place for 9 meters squared. You need goggles as well. We are going to talk about the cost in a little while, but this is a software sold by a company, and they do not give you full access. They give you only yearly a license for each set of goggles, but it's very cost effective when you're I mean, you have your goggle and you can check for the students in small groups, for example. You don't need fancy mannequins. You can create your own software. It's hard, but you can do it. Yeah. Thank you for all the feedback. So this is me trying the scenario. This was another scenario, a scenario of a patient with pneumothorax who was in an ambulance. So the requirements is you need a hardware, you need a VR set and a computer. The software is $3,000 annually, and you need an empty space to walk around 3 meters. You can work in groups. You can do interprofessional. You can have a nurse, a doctor working at the same time. You can have different people, and you can assess them. You have their actions all jotted out. There's a control screen. So for our school, we thought about acquiring this, and we thought about 3 or 4 headsets, and it would cost this much, 16,000 to 30,000. In our school, we have like 50 kids, 50 students in each class. So we thought 4 goggles would be enough, but we are still trying to work on it. There is another concept which I just tried. It's called, I mean, we already have it now. Like, for example, this is a virtual classroom. If you think about it, we are in different countries, in different time zones, but we are still connecting through a software called Zoom. So what is virtual classroom? What are its advantages? It's again, as the listeners have commented, a safe environment. So these people are wearing goggles, and in the goggles, they're in a very big classroom, as you can see here. So, for example, here they're going to do a spine surgery. They have the CT image of the patient here. You have the abnormal anatomy of the patient with the anatomy like this. You can explore, you can go, you can start the surgery, you can try to put the screws. If you do it in the right way, they go green. If you do it in the wrong way, they turn red. You can put all kinds of imaging. You can the software can turn it into 3D, and you can work with, like, as you can see, there are 1, 2, 3, 4, 5, 6 different surgeons looking at every angles. You can teach your residents before surgery, and you can because it's very hard to train people, train residents on real people, and it's sometimes not safe for the patients as well. And you can look at all the angles of the surgery. The surgery can be taught by your peer, and you can be inside the surgery. And the good thing is you don't need to have the goggles for this. You can also watch this from your own computer. So, but being in it, of course, in 3D, in virtual is better, but sometimes it's costly. But you can also observe this in normal computer. So what shall we do? So reported effects on academic performance cannot be solely attributed to the gamified interventions due to the absence of control groups. Gamification research is still in its infancy, and positive results may have been overreported due to publication bias. There are studies, but they are small pilot and small scales, and gamification can have unwanted effects. Competition. Not everyone is happy of being in a competition. Not everyone has same characteristics. For example, you have a leaderboard projected to the blackboard, as you can see, and I'm the last person here. I may not feel as motivated, or Asma passed me, but Minuta passed Asma. And sometimes people only try to get points. They do not want to learn. So you have to make a good balance of what you are doing in your classes. So I'm open for any questions, comments, and contributions. I would like to thank you for your patience, and I would like to emphasize my gratitude for having the privilege of being in this journal club.
Thank you very much, Dr. Emery, and thank you for the presentation and for the examples, really authentic, and we can understand the whole idea from your examples. I actually have a question that you quite have answered at the end of your presentation about the competition. As Dr. Asma at her take-home message said that the whole idea is about learning and collaboration, not competition. And you repeated this in your take-home message. But most of the games are based on who will be ranked the first and the ranking, and this create a competition by itself. by itself. So if we withdraw this option, for example, from Kahoot, we didn't share the ranking with the student, do you think this will affect the learning, or we should use it?
I think it will affect the learning. I mean, sometimes you try to pass people, but like you can have it for yourself only. But you have to have a very good balance. Some students are not; they're more introvert, so they would like to. They don't want people to know how they score. So you can talk with them beforehand. You can get their permission like this. For myself, for learning as a third or second language, I sometimes use Duolingo, for example, and in that I think it's a very good application. You can use only 5 minutes of your time and you can learn stuff, but there's a scoreboard, and it doesn't reflect on how much you learn. For example, sometimes you have multiplication of scores, and sometimes if you do something twice, this is something you already learned, you are familiar with it, it's sometimes very basic skill, but you can still get some high scores. So if you want to really become the leader, it doesn't mean you learn everything, but it depends on how much you score, and they are trying to solve this about Duolingo. So the competition part is very important. I mean, you can score, like, if you think about football terms, you can score 10 very easy goals, or you can score a very, very nice goal, for example. So the teacher, the facilitator needs to decide on how to use everything, and the facilitator needs to know the audience in a very good way. For example, we are health professions, education professionals, but like we were 35 people, and as you see, not everyone joined every session. So even in this audience, even in this very elite and selected audience, it's very hard to engage everyone. Maybe people don't want to join. Maybe people listen to you, they understand, but maybe people don't want to join the quizzes, for example. Maybe afraid that they're going to score low and everyone is going to see. It's something very important, and something especially important in lower education and also in undergrad education. Yeah.
Emre,
Thank you.
if I may reflect on Dr. Ange's question, because what you are describing now is not really, although it's very interesting, of course, and highly advanced, but it's still, we were aware of all of this since almost 40 years, when we were trying such high technology. And one of the problem formats in PBL, one of them was called computer format, where the students, the undergraduate students, can even by using such highly advanced techniques, they can even perform operations. And if they do it in the wrong way, probably if they cut a major blood vessel or something, then the whole screen turn red, and all these very nice techniques. We used to speak about it since 40 years, but for some reason, because it's still very costly to buy, and such softwares, we don't really use it very frequently in our undergraduate education. But if we try to to deal with this sort of competition, which Dr. Angie was talking about, if we use it by group learning, if we are in a class, in a PBL class, and the group of students all together work step by step they take each other's opinion and then they advance what they are doing step by step by group consensus. Then the competition is less, and we use group learning more than using such highly advanced techniques by individuals. So what do you think if all this is used by groups rather than by individuals?
Yes, so very good point. So being, I mean, like being in a group, as group learning, in a problem-based learning session, and using these techniques, not in a competition way, is, I think, better and more engaging if you want to engage people. But I think, like, for example, if you are teaching a very basic stuff about like the theory, you try to teach like the basics for 30 minutes. Doing this competition stuff could be engaging, and you can put the leaderboard for very simple questions which will not affect people in a bad way. Like, for example, for the meeting, just for icebreakers, you can use these kind of simple games, so break the ice and engage people more. And then the way you go into it with PBL and teamwork, you take out the scoreboard and use them for more for engagement purposes.
Okay, thank you, Dr. Emre. Dr. Asma, you want to comment?
Yeah, I thank you for your question. I need to add that according to the culture of our students and how we are doing the preparation for them, what is the aim of our gamification in this situation? Are we aiming to increase their engagement and increase their participation and be more aware about the learning content, and we need them to gain knowledge and retain this knowledge, and need you to be more active participants inside the session, or just a competition? And as Dr. Emre mentioned, that they are reward oriented. You know, most of our students score oriented, so we need to shift this mindset and change their brain and ask them to be more more active to gain learning more than you are gaining rewards or scoring and so on. Also, collaborative way or team-based concept better than using of individual, because they allow the student to be as a teams and catch each other work, plus using peer learning. If we encourage them to do some kind of peer activities, will encourage more participation of all the group, and we can reach our purpose from this gamification inside our learning session. Thank you.
I would like to remind Dr. Asma and Dr. Emre that at the FAMER Institute, the spirit is that we prefer collaboration over competition.
Yes.
You know, yeah. Thanks.
And also, Prof, to add more in this, in FAMER Institute, they always showing us our progress in our dashboard. They're using the progress report instead of using the scoring report. And we are not in competition with each other. We don't know who is better than one. All of us are going in his own or her own milestone of progression. And according to this progression, you are achieving your goal setting and your mission and your progress toward finishing all assignments and all requirements of FAMER. So it is good concept for adult learning.
And one addition, also Dr. Mona Abdul wrote in the chat, it's very important to know your audience. The cultures could be different from country to country, so you have to know your audience, because like people could be more self directed in some cultures, and people some people hide their notes but some people are more open, more collaborative. So you have to be aware of your audience. You have to be aware of your requirements, and you have to, for example, if you, in our hospital we don't have that many patients, so we try to provide our students with more simulation based or simulated patients. But if you are in a very big hospital with a lot of real patients, you can adapt the students to the real patients in a more quick way. It's very important where you are, who you are, how much money you have, how much are you going to willing to spend, is it worth it? It's very important.
Okay, brilliant. Thank you, Dr. Emre. And we have Dr. Shaima in the chat talking about TBL. For example, in the TBL individual answer question in IRAT, and then in Teams in a JRAT. Okay, so I think Dr. May, you mean to use individual and the group work in the same session. Dr. Nancy, changing the concept computation to calibration not easy, even in adult learning. I totally agree, but I actually like Dr. Asma reflection on the culture and Dr. Emery's reflection on knowing your audience. But yeah, I agree with you, Dr. Nancy. It's very difficult to change people. And it's actually attitude, and Dr. and Professor Wagdi usually say that the attitude is usually difficult and usually neglected in some cases. Okay, thank you so much. If anyone have any question, a final question before we conclude the first session, we are happy to have you. Please raise your hand or type it in the chat. While we are waiting for a question, I would like to explain the format of our journal club. Now we finished the first session that I said that will be expert-led, and we have our prestigious expert today. The second session, which is scheduled 1 month from now, is an connected session where it will be led by you as a participant. So you will receive email after this session asking you to nominate articles about gamification. Please go and explore the literature about gamification and nominate an interesting article you find so we can discuss in the second session. Also, you will have two options, either to just nominate an article and Dr. Asma will moderate the session, or you can present the article as well, and all of the participants will use other critical analysis and critical thinking to analyze the case and learn from the literature. So please expect this email after the session, and we are waiting for your nomination and also for your presentation.
Dr. Angie, can I make a wish now?
Yeah, sure.
Out of this wonderful session, and thank you, Dr. Asma and Dr. Emre, for this very wonderful session.
Thank you.
I'm just inspired with all of that, and you always said that this could be very costly, especially to developing countries, and we are all, I think, here in this session are from developing countries. Can we reflect from that on our research work group in ESME Society and try to make some research work on such formats and try to develop very simple format, or to try to develop further such very sophisticated format to make out of it a more simple and less costly software that we can use in our settings without having to buy such very sophisticated softwares that would be unaffordable for us. So in case we can, let's next time when we hold our next meeting, explore this possibility together. And if the answer is yes, then we can make a group of us who would try to make such very simple softwares that we can distribute for free and use it as a user-friendly format. Thank you.
Thank you, Professor Ragdi. Yeah, it's I wish that we hope can come true. And actually, the aim of the Journal Club is to explore literature and find gaps and generate research within the ESME committee. And actually, we were planning that at the end of the second session, from our reading, we can generate some research ideas. And if anyone interested, we can create small satellite groups for doing further research, national or international level. So thank you for raising this up today, my dear professor. And thank you all for your participation and for your contribution. Thanks, Dr. Emery, and my dear colleague, Dr. Asma, and have a nice day.
Thank you, everyone. Thank you, Dr. Emery.
Thank you. Have a nice day. Thank you.
Would you take a picture for all of us?
Yeah, I would like to,
should-
but if
yeah.
some of you turn on their cameras, it'll be better.
Yeah.
Yes.
I will give a second until people turn on their cameras. We have a special guest today, but I don't know if he's still with us. Dr. Muhammad Shams. We are happy to have you today.
السلام عليكم دكتورة أسماء.
Salam.
عليكم
دكتور
السلام.
إنجي دكتور وجدي.
عليكم السلام, Dr.
ازي
Muhammad
حضرتك؟
Shams.
دكتور
What a
محمد.
surprise.
How are
What
you?
a
Thank
surprise
you.
having you with us
Honor.
today.
It's honor to have you today, Dr. Muhammad.
Actually, it's my honor, Dr. Asma. Thank you so much, and I'm very, very grateful for this meeting. Actually, I'm very honored to be with Dr. Wagdi. He is my professor, not only in the medical education, but also in the pathology. Dr. Wagdi, if you remember. After
Forget about pathology now.
Yes, after that,
I left pathology for
after
more than 25 years now.
Yes, sir. I lived much of them with you. Actually, the meeting is very interesting. The topic is very interesting. The naming of gamification, Dr. Asma, thank you so much for it. But actually speaking, gamification was confusing to me, because it's more than using games. It's more than just play a game. It's a simulation more than a gaming. It's very complicated, as Dr. Emery said, and I'm a surgeon like you, Dr. Emery. I have two comments to say. Just two comments. Dr. Emery, you mentioned during your talk something it was not what I can say. I don't agree for it actually, that human life has a greater value in developed countries than developing countries. It's not political, but human life and human value is the same everywhere and at any place. But it's not a value. It's how to appreciate it and how to use it and how to deal with this value. But the value itself is the same everywhere. I'm not raising this issue for discussion, but just a comment for the sentence you said.
Thank you, Dr. Muhammad. Before we hear Dr. Emery's answer, Dr. Enji, can we take the group picture first while opening all our cameras? And Dr. Muhammad Shams, if you can open your camera.
Yes, sir.
To be included in the group photo.
Yes, sir.
Okay.
Yes.
Okay. In 3, 1, 2, and now.
A second, please.
Okay, we're waiting for you.
Yes, I'm here, sir.
Okay. Okay, thank you.
Thank you, Dr. Wagdi.
Thank you so much.
for this.
Thank you all.
The second comment from me is that, did you make it, Dr. Angie?
Yes, yes, thank you so much.
Can I
Please
continue or
proceed.
not?
Yeah, please proceed. Yeah.
Simulation is not new, especially in surgery, anatomy, and some other disciplines. But actually, simulation is getting very complicated. Getting into virtual reality is making it more complicated. Complication means more cost. And the problem is the cost. How you can get the software, how you can get the hardware, how to train people to use them, how to change the value of them, or change the culture to accept and use them in the proper way. But if we go back to the history, the same happened with robotic surgery. Robotic surgery is just a simulation. You are doing some very complicated surgeries now for people might be in another continent, might be in the sea, might be in underground. But now it's available everywhere. People get training. Cultural change is getting well. Even the cost is getting lower. So with time, with the availability of the technique, the availability of the of the software and hardware, people will accept things. And actually, I will get some phrase from one of the eminent surgeons in Dundee, who said that we do things because anyone who will stand against changes and progresses will be stepped over, and things will go on. It's not the acceptance. It's as I told you, it's more complicated than the acceptance. It's availability, it's cultural change, it's cost, it's how to use it properly. How to use it properly and don't misuse it, because every change, every advances had its pros and cons. You can use it in the proper way, and many else will use it in a very improper way. So this is a very powerful ethical issue, a very powerful not only culture but moral more than cultural issue, that when we share this and when we provoke this, we must also discuss these issues, not to get into the sloping slope or sliding slope, and we can never stop things to be used in the proper way.
Thank you, Dr.
Thank you.
Mohammed. We will consider this as a
but
comment rather than a question to Dr. Emery, and to stick to the time. I think we already have passed
thank you
the
so
hour.
much.
Yeah. And we invite you, Dr. Mohammed, to apply for the membership of ESME Society if you did not already apply. Okay? Back to you, Dr. Angie.
Yeah, thank you so much. Thank you, Professor Mohammed, and thank you, Professor Wagdi. Thank you all for your attendance today, and we are waiting for your participation in the second session. See you and have a nice day.
Thank you so much.
Bye-bye.
Thank you.
Thank you.
Thank you, Dr. Emery. Nice to meet you.
You too. Goodbye.
Okay. Bye-bye. Have a nice day.